Welcome to this ninth installment of our special series on depression. So far, we have explored the biological significance of the symptom through the lenses of biology of meaning, BOM, German New Medicine, Carl Jung, and Ken Wilber. Today, we begin looking at treatment through the perspective of traditional Chinese medicine, a system with over 2,000 years of history and foundational principles that asks not only what illness a person has, but how they have lost their balance. In traditional Chinese medicine, depression is not a single, uniform diagnosis. Two people might receive the same psychiatric diagnosis, yet present completely different energetic syndromes. That is why treatment never begins with prescribing pills or inserting needles. It begins by deeply listening to the human being. The practitioner, whether an integrative nurse, holistic coach, physician, therapist, or biotherapist, conducts an expanded clinical interview within their scope of practice. They ask about more than just sadness. They ask when it began, what happened beforehand, and about sleep, diet, breathing, bowel function, relationships, past losses, current sense of purpose, medications, existing medical conditions, and abandoned dreams. In Chinese medicine, everything speaks. Next comes the energetic assessment. The practitioner observes the person's general appearance, posture, tone of voice, breathing, complexion, gaze, vitality, presence or absence of movement, tongue, pulse, body temperature, and daily habits. None of these aims are to label the person. Rather, the goal is to understand how their qi, vital energy, circulates, where blockages exist, and which systems have lost harmony. A classic pattern appears in many cases of depression: liver qi stagnation. The person sighs frequently and experiences chest tightness, irritability, frustration, a sense of being trapped, and difficulty making decisions. When this blockage persists for months or years, it can transform into internal heat, disrupt sleep, trigger anxiety, and ultimately affect the consciousness or mind as described in Chinese medicine. In other patients, the primary issue is not the liver, but spleen deficiency. Persistent fatigue sets in, lack of motivation, obsessive thinking, poor concentration, slow digestion, heaviness, a constant need to sleep. Here, the treatment approach will be completely different. In other cases, there is a heart deficiency, the heart being the organ responsible for housing the spirit/mind. The person loses their sense of joy. They become fearful. They experience insomnia, heart palpitations, forgetfulness, and a sense of emptiness. Once again, the therapeutic strategy changes entirely. There may also be kidney insufficiency, an accumulation of phlegm, tan, that clouds the mind, or complex combinations involving multiple systems. That is why FARO never proposes the same treatment for everyone. First, we understand. Then, we intervene. Chinese medicine teaches that prolonged emotional states alter the body. Yet it also offers a message of profound hope. When the body regains its balance, many emotions naturally begin to transform. This does not happen because life's problems magically disappear, but because the body once again possesses the biological resources needed to face them. This is where one of the key contributions of the FARO method comes into play. We do not work solely on emotions, nor solely on the body. We integrate biographical history, biological conflict, energy, consciousness, relationships, existential meaning, and daily habits. After all, a depressed person needs far more than just being told to think positive. They need to understand what happened, regain their resources, and find a sense of direction again. Traditional Chinese medicine offers an extraordinary roadmap for embarking on that journey. In the next section, we will look at how the actual treatment is carried out, using acupuncture, auriculotherapy, Chinese herbal medicine, energetic dietary therapy, therapeutic qigong, conscious breathing, tuina, and other integrated interventions. FARO always incorporates these as a complement to scientific medicine, while respecting the laws and professional scopes of practice in each country. FARO learning. Depression is not treated merely by suppressing symptoms. It also requires discovering which system has lost its balance and supporting the body as it regains its natural capacity for adaptation. FARO quote, "True therapy begins when we stop asking what illness a person has and start asking what they need to regain their balance." Put the FARO method into practice. Subscribe and follow our YouTube channel to learn more. Leave a comment. Hit like. Share this to help raise collective awareness. Learn science with a conscience, because in health, knowledge is not neutral. It is vital.